The World Health Organization (WHO) has declared a public health emergency of international concern (PHEIC) due to a rise in cases of Mpox, particularly focusing on the Clade 1b strain. This declaration, made on August 14, 2024, underscores the seriousness of the situation but also emphasizes that Mpox should not be equated with COVID-19. According to Hans Kluge, the WHO's European director, Mpox does not pose the same level of threat as COVID-19. Unlike COVID-19, much is already known about Mpox and its control measures. Kluge assured that while the Clade 1b strain is concerning, particularly due to its impact in the Democratic Republic of Congo and surrounding areas, the situation is manageable. He stressed that the WHO's focus is on controlling the outbreak through established public health practices rather than implementing measures akin to those used during the COVID-19 pandemic. The previous PHEIC for Mpox was declared in July 2022 for the Clade 2b strain, which predominantly affected gay and bisexual men. The emergency status for this strain was lifted in May 2023. The WHO's current concern revolves around the more severe Clade 1b strain, which has resulted in more than 500 deaths and is spreading across several countries. The rise in cases has led the Africa Centers for Disease Control and Prevention to also declare a public health emergency and seek international support to curb the outbreak. Kluge highlighted that Mpox's primary mode of transmission is close skin-to-skin contact. However, there is a possibility of transmission through droplets from individuals in the acute phase of infection, particularly if they have lesions in the mouth. The exact modes of transmission are still under investigation, and more research is needed to fully understand them. The WHO is not recommending mass vaccination or the use of masks at this time. Instead, the organization advises using vaccines in targeted outbreak settings for those most at risk. The focus is on implementing effective surveillance, investigating new cases, and providing sound public health advice to control the spread. Behavior changes, non-discriminatory public health measures, and vaccination have all been instrumental in controlling previous outbreaks in Europe. The recent rise in Mpox cases has prompted global concern, but Kluge emphasized that the situation does not necessitate lockdowns or severe restrictions akin to those used during the COVID-19 pandemic. The emphasis is on controlling the outbreak through established public health practices and targeted interventions. WHO Director General Tedros Adhanom Ghebreyesus also expressed concern about the potential for further spread of Mpox both within Africa and beyond. He called for international cooperation to address the outbreak and prevent its further dissemination. While the Mpox outbreak is serious and warrants international attention, the WHO is confident that with the right measures and cooperation, the spread of the disease can be controlled without resorting to extreme measures like those implemented during the COVID-19 pandemic.